Dear parents, Assalamu alaikum. Dr. Zafeer with you. Today we will discuss about our late talker, the child who is having delayed speech. For normal speech development in child, hearing is most important. Mama, Dada, unique words known to us since centuries. These are often the first words if spoken by a baby, and they can turn an ordinary day into a memorable one for parents. But if children seem to lag behind their peers in their ability to talk, it can create anxiety and plenty of sleepless nights among parents, and perhaps prompt worried calls to the pediatrician asking, "Why isn't my child talking?" So, who is late talker? Between 18 to 30 months, the child who has good understanding of language, typically developing play skills, motor skills, thinking skills, and social skills, and has a limited spoken vocabulary for his or her age, or fewer than 50 words by 21 to 30 months of age. So this is called late talker. About 15 to 25% of young children have some kind of communication disorder. 5% of school-age children have speech and language delays. Children who began watching TV before 12 months and who watch TV more than 2 hours per day were 6 times more likely to have language delay. Boys tend to develop language skills a little later than girls. In the majority of cases, however, there is no need for alarm. Most children develop language at their own pace, and there is a broad range of normal variations. Some children develop language at a faster rate than others. Before getting worried, parents should know about speech and language milestones. At the age of 2 months, cooing sound and response to voice. At the age of 6 months, babbling sound. At the age of 4 to 9 months, turns to sound, response to name. At the age of 9 months, Dada, Mama, non-specific, begins to understand no. At the age of 9 to 12 months, some jargon words. At the age of 12 months, Dada, Mama specific, one additional word, and jargon is complex, points to gesture, follows one-step command. At the age of 18 months, 10 words, knows body parts. At the age of 2 years, 50 words, 2-word phrases, can point to specific objects in a picture. May know one color. This is at the age of 2 years. Follows 2 steps command. At the age of 3 years, 300 to 500 words tells a story and tells a story. Number at the age of 4 years, grammatically correct sentences. By the age he is 5 years, your child should be able to retell a story in their own words and use more than 5 words in a sentence. Although the cause of late talking in children who is developing normally in other areas is not well known. Many late talkers naturally catch up on their own, others do not. It is important to identify the risk factors and the signs to watch. For example, family history of speech and language delay or disorder. Number 2, male gender. Number 3, maternal depression. Number 4, prematurity. And number 5, birth weight less than 1000 grams. Hearing issues, a history of ear infections, little babbling or cooing as an infant, doesn't imitate words, doesn't use gestures or only uses a few gestures to communicate, use mostly nouns and few verbs, has a limited number of consonant sounds, difficulty playing with peers due to lack of ability to communicate, acquires a new word and then loses it. So when should you worry? If your child is over 2 years old, if he can only imitate speech or actions but don't produce words or phrases by himself, he says only certain words and only those words repeatedly, you should have your pediatrician evaluate him and refer him for speech therapy and a hearing test. There are ways to build language and communication skills for late talker. Sign language. Sign language is one type of alternative communication that has been proven to facilitate speech development. Music. Some children learn to sing before they can talk. Number 3, vitamins. A recent research conducted in Australia on 750 pregnant women and their children over a period of 10 years. Researchers found a connection between vitamin D deficiency and speech and language delays. Questions versus statements. Avoid asking a series of questions to your late talker, especially when an adult approaches him and starts, how old are you? What grade are you in? Do you like school? Are you shy? All these things to avoid. Number 5, imitation. The single least effective method for stimulating speech in a toddler is to tell the child what to say. Ball, say ball, cat, say cat, etc. Slow down. This is important for when you are talking to the late talker. Some children have difficulty understanding the beginning, middle, and end of a word. It is helpful for the adult to slow down his or her speech so that the child can comprehend and respond. Number 7, provide rich sensory experiences. And number 8, play to talk. This is very important. All humans communicate through play. Play is the ideal way to encourage back and forth exchanges of ideas with young children. Between 70 to 80% of late talkers seem to catch up to their peers by the time they enter school. Sometimes these children are called late bloomers because they eventually seem to catch up to other children of their age. Some children with delayed speech and language skills will grow out of it. Others will require speech and language therapy to help them along. There is no way to tell which route your child will take, but if you are concerned, there are many things you can do at home to help your child's speech development. A good rule of thumb is to talk to him as much as possible. During playing and talking, keep video recording and later on both of you listen together. This will motivate him to talk. Let's talk about your concern. Majority of parents think that late talker means autism. In reality, there are a wide range of reasons a child may talk later, ranging from working through a developmental stage at their own pace to physical issues such as hearing loss. Population studies have proven that only a very small percentage of children who are late talkers have autism spectrum disorder. There are 3 main symptoms of autism. Delayed milestones. This is very important. A socially awkward child. Number 3, the child who has struggled with verbal and non-verbal communication. Now, let us take a child of 2 years and recognizing the signs of autism in a 2-year-old child. He doesn't keep eye contact or makes very little eye contact, doesn't respond to a parent's smile or other social expressions, doesn't look at objects or events a parent is looking at or pointing out, doesn't point to objects or events to get a parent to look at them. Now, if you take a 3-year-old child, what are the autism symptoms in a 3-year-old child? He doesn't respond to name, avoids eye contact, prefers playing alone, doesn't share with others even with guidance, doesn't understand how to take turns, is not interested in interacting or socializing with others, he doesn't like or avoids physical contact with others, and he is happy in his own world. Most of the parents and family members pass their time in front of TV. Important message to TV lover parents. A study found that children who began watching TV before 12 months, who watched TV more than 2 hours per day, were 6 times more likely to have language delays. That could mean late talking and or problems with language in a school later in life. So there are few take-home message. Hearing is most important for speech development. Number 2, if he speaks less than 10 words by the age of 18 to 20 months, he is late talker. About 15 to 25% of young children have some kind of communication disorder. 5% of school-aged children have speech and language delays. Boys tend to develop language skills a little later than girls. In the majority of cases, however, there is no need for alarm. Most children develop language at their own pace, and there is a broad range of normal variations. Some children develop language at a faster than others. Between 70 to 80% of late talkers seem to catch up to their peers by the time they enter school. A good rule of thumb is to talk to him as much as possible. A small percentage of children who are late talkers have autism spectrum disorder. Children who began watching TV, iPad, cell phone before 12 months of age and who watched more than 2 hours per day are 6 times more likely to have a language delay. If you like this video, please subscribe and share. Stay safe, stay blessed. Thank you.